Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about using medical record templates. We are going to discuss the good and the bad of adopting the technology of being able to create templates for progress notes. This is aimed at mostly providers that are going to be documenting in progress notes for patients. However, I also want managers, administrators to be watching this as well, because ultimately it could be your responsibility in the practice to ensure that the use of templates isn't being overused or abused. This video is going to talk about the benefits, but also some of the things that could be negatives because of how it's used. And I want you to stick around to be able to make sure that you aren't following some of these bad habits. Before we jump in, I just want to make a disclaimer that this is not legal advice. I am not a certified compliance person in healthcare. I do not do any kind of certified audits. However, I'm going to speak from my experience, my observations, things like that, to hopefully bring awareness to you so that you can make sure that you aren't following some of the things that could possibly lead to further problems in your practice, okay? So let's go ahead and jump in. Let's talk about the good side of using templates and progress notes. Obviously, it's going to be efficient, it's going to be consistent, and it's going to help support your billing team if you have someone that's going to be scrubbing your notes and ensuring you're capturing everything to charge. There's also the speed factor, being able to add things in the different sections of the progress note and reducing errors. One of the biggest errors that I used to see before we had spell check built into our progress notes electronically is the misspelling of health-related words, because unfortunately back in the day a lot of the systems only had basic dictionaries built in. They didn't have like a medical dictionary, so some of those medical terms used to be misspelled, mistyped, however you want to look at it, by providers. But now with being able to create templates for specific things, it's less likely to see that, as well as the improvement of the dictionaries that are built into the systems. It also helps reduce the amount of clicks and typing that needs to be done during the visit, and it allows the provider to pay more attention to their patient during visits. That was one of the biggest complaints that we had when we transitioned from paper to electronic records, is that the patient didn't feel like the provider was paying enough attention to them because they were constantly typing and making notes, things like that. Where templates allow providers to not pay as much attention to their screens, but to the patient, and be able to add just short notes, however that may be, by just a click or just a little bit of typing or a macro or something like that. The other benefit of the templates is ensuring that nothing is forgotten in like the review of systems, going through all of the body functions and ensuring that you're asking the patients the right information, recording the information after it's provided to you, and things like that. Then you have the billing support and the recall, right? It helps with identifying the correct level of E&M if you're doing it based off medical decision making. If you're going to be recording and basing it off time, the template will help you remember to record the amount of time so it's there. It will help you make sure that you have insufficient documentation. It will cut down on that and make sure that it hopefully helps with avoiding, I should say, denials and rejections, things like that. And then also, one of the benefits is when you hire new providers, especially out of school, it allows them to adapt a little bit faster, because they can either use existing templates that you use in your practice across all providers, if that's a capability of your system, or they can take the time and create their own based off different reasons for patients being seen, and it just helps them be able to be better providers and to learn faster, not only as a medical professional if they're green, but also to the way of your practice, seeing the amount of patients they need to, etc. Having seen paper charting back in the day and then now the electronic charting, it's amazing how much more detail is provided by providers and the doctors in all of the information. However, now I want to talk about the bad side, the side that can lead to issues because of cloned text or putting you at a risk for audit because of it. Okay, so I have some notes that I really wanted to make sure that I bring up with my concern of using templates, and I'm going to be referring to my notes a little bit more during this section just because I don't want to miss anything. I took a lot of time to put this down for your benefit, okay? So let's go and talk about the cloned or carry forward errors. Unfortunately, a lot of healthcare providers I see like to bring forward past notes into a current date of service. And that is all good and well in a lot of cases, but you have to edit those notes because not everything discussed in the past is relevant for today. And things will be erroneously documented that didn't happen, or it will give someone a diagnosis that wasn't real for that date of service. And that can have a lot of downstream effects. The biggest thing I see since telehealth has kind of come on is that somebody will document or pull forward a telehealth visit, but the patient was actually seen in-house, but they document that it was telehealth. So maybe in the schedule, it looks like the patient was scheduled on site, but then it's documented that it was telehealth, and then it's coded a certain way, and it's really confusing to actually figure out which way was correct. You have claims possibly going out incorrectly, etc. You can have over-documentation of irrelevant systems and under-documentation of any decision-making that actually drove the visit for today or the current visit because it wasn't removed, the old stuff and the new stuff added. It was just taken for granted, oh, this is close enough, or I'll go back in and I'll do this. And sometimes that does not happen a lot of the time, unfortunately. Because of this, you are at a higher risk of audit and compliance because every note needs to be unique. It cannot look like it's the same as a past one because then the integrity of the note is questioned. Then the billing of the note becomes questioned, and it's just not good medicine, and it's not a good look either. It is really important that if you are bringing forward any cloned information or past records, that the provider is actually editing it. Unfortunately, again, I know I keep saying unfortunately because it's so true, but I am seeing providers bringing stuff from the past, not editing current stuff, and they know that they already have a lot of their documentation, quote, taken care of for that visit, and they don't go back to complete that visit until well after the memory of what everything went on is done, and then it's guessing or not super clear when you're trying to edit those notes, and maybe you're missing even more. It is just really, really bad. So you have to make sure, because if you're getting records sent to insurances and they're noticing that every record sent by one provider or even all your providers are looking exactly the same and they are not seeing many changes, they're going to prompt an audit for your practice. Or even if it's only seen for one provider, it will trigger it for the whole practice. They won't just do one provider. So you need to make sure as an administrator, office manager, that you're doing internal audits and checking, making sure that your doctors, your mid-levels are not carrying forward and leaving things the way they are. You need to make sure that they are clean, clear, new, and that they're just using some of the old basic information, maybe medications, allergies, existing chronic conditions that are relevant for that visit, things like that. The other concern that we have with the carrying forward, the cloning, the using of templates that are all the same wording and not making enough changes is that when patients see their chart notes, whether you share it on a portal or they ask for a copy, they're going to notice that things are repeated exactly the same every time they're seen. And then they're going to possibly start questioning their care, the knowledge base of their doctor, things like that. And you don't want that to happen either. Between the integrity of the note and making it seem like either you don't know what you're doing or you don't care what you're doing, insurance companies are going to trigger and audit you for inconsistencies or two consistencies, I should say. And patients are going to wonder what the heck they're doing going to see you as a provider. You don't want that. Again, templates are great, but you have to make sure that you're using them appropriately. We all know that using templates is because of the convenience factor, but also we have a lot of growing administrative burden in healthcare. We know that providers are asked to do way more now than they did 20 years ago. And it's getting very tough to keep up with all of the demands. Plus, because reimbursement often has been declining for most people, that means that your patient volume usually goes up to try to make up for that lost revenue. Therefore, you're trying to rush patient to patient because you're seeing more in a day. And these templates make it a little bit easier. The root causes of the cloning and the inconsistencies or too consistent are definitely because of these reasons. However, if you don't have anybody in your practice, like an administrator or an office manager, reviewing and doing random audits to ensure that this isn't happening, then it's going to continue to happen because there's no, quote, consistency or accountability for consistency in your practice. Also, when templates are made, whether it's by an individual provider for an individual to use on their own, or you have templates that you can use across the practice, if there is no ownership of those to make sure that they get updated to new policies or new requirements, things like that, you're going to continue using old information and nobody's going to be updating the CPT codes that might be populating or making a note on there that said this is telehealth and the patient gave me verbal authorization to be able to conduct this visit via telehealth today. Those kinds of things, you're going to just continue to have issues because nobody is, quote, an owner of fixing any of that and staying on top of it. So if you are using templates in your practice, you want to make sure at least someone is assigned to reviewing these once in a while and helping with those random audits and talking to the billing staff to see if there are any denials or rejections happening because of inaccurate templates being used. Another root cause of templates being used that possibly shouldn't or are not being fixed is habit. Unfortunately, we are creatures of habit, being humans, and when something is convenient or we know it's available and it is used often, it just becomes a habit. And a lot of doctors and mid-levels might not even realize that they are hitting carry forward or they are bringing stuff into a new note because they've been doing it for so long. It's just a habit, a bad habit sometimes, and then they take for granted that the information they brought forward or the template information they're using is still current. But again, if nobody is owning those templates and updating it, they're assuming maybe they are being updated or they don't think they need to be updated, and that habit is overriding the good practice of using them. Another thing that everyone needs to be aware of in the practice that's using templates, even your medical assistants, nurses, anybody that's going to be using templates for patient documentation needs to be mindful of this. Some suggestions to avoid any of these bad habits or the inconsistencies is possibly only have templates for certain sections of the progress note. Start small and don't just have all the note completed for everyone, because that encourages everyone to put in their own information from that specific visit. Don't make abnormal easy. You can make normal easy, but don't make abnormal easy. But you can try to make anywhere that needs to have abnormal documented possibly a little bit easier to document, but don't make abnormal something that is common and built into templates. Separate reusable blocks, like have an HPI starter, a problem list update, physical exam mini sets instead of the whole set, and assessment plan scaffolds. Like, have some things that are helpful, but don't build the whole thing out. Force intention. So require a quick, like, today justification line in the assessment and plan that they have to complete, which would mean that they would have to review the entire document before they sign it off. And on sensitive exams like neuro, psych, GU, unless it's confirmed, don't have a default normal either. So you don't want to make abnormal easy, but you don't want to make normal as a default, because if there is an abnormality and they just carried something forward that says normal, it could be inaccurate. So you have to find the balance there. And then you want to make sure that you include prompts if possible, that the data was reviewed, the risks were reviewed with patients if it's during or for a procedure, and there's a because statement. That would definitely help with making sure that things are reviewed appropriately. Like I talked about, have somebody responsible for governing and maintaining these templates. That's going to be really important. And when you're training the providers to use these templates, or you're onboarding a new provider, you need to have them understand what are the good habits of using the templates and what are the bad habits, and what you look for, and that you're going to be holding them accountable. And you have somebody who will be doing random internal audits for all providers and all notes. That's not just your mid-levels and providers, but if your back office staff, like your nurses, MAs, use templates, you should be auditing them as well. You want to ban blind copy forwards and just allow them to do structured pull-ins if possible, and use smart phrases, which is good if you can do that. You have to learn your system. I would recommend going and looking at my super user video and assigning someone a super user in your EMR to be able to sit down with your providers for this topic and be able to show them what is good and how to do it thoroughly. And then add a patient voice line, like a one sentence in the HPI that reflects the patient's words. Of course, that's how we're taught, but not everyone actually practices that. I recommend really looking at how things are going in your practice right now after this discussion, doing some internal audits. If you haven't, speak with your billing team to see if they're seeing any types of trends where you're getting audited. We know United Healthcare audits a lot of things, especially level 4 and 5s. You don't want to get yourself in a pickle because of this. You just want to make sure that you have good documentation habits, good billing habits, and that everyone has some kind of accountability and responsibility when it comes to using templates in the system. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. And as always, please share this with your colleagues whom you feel would benefit from the information. I appreciate the support, and we will see you next time. Bye-bye.